ladies and gentlemen, welcome to A Better Way. I'm Dr. Tabor Smith, and I have with me today a great friend, an amazing doctor, Dr. Aaron MacArthur. He specializes in migraines. He's what we call a chiropractic neurologist. And Dr. MacArthur, I just want to say thank you for taking the time out of your busy schedule to be with us today.
Oh, it's my pleasure, buddy. It's great to talk with you, and I always love talking about migraines.
Yeah, and in fact, I'm interested. Tell us about what you do a little bit more, but then also, how'd you get started studying migraines?
Yeah, actually, I'll start with the second question, just maybe, and that might kind of make sense of the first one. But I was I was realizing that there weren't a lot of great treatments for migraines out there. Medications are helpful, but not really fixative. Right?
Mm-hmm.
And we know that, and these types of medications anyway, the migraine types and the triptans and these other, aspects of it. But a lot of my patients were coming in with migraines, and I had realized that it's not something that people with migraines really considered chiropractic to be able to help. And
Right.
I was surprised at that. So I said, well, geez, so I started studying it more and learning more about it, and then working with these patients more and helping them quite a bit, and then furthering my study in at the time I had my neurology diploma, and I still do, but I realized a lot of these patients had also vestibular symptoms. They had a lot of nausea, some of them had vertigo, dizziness, lightheaded aspects, and I realized I needed to learn more about the vestibular system. So I pursued a fellowship in vestibular rehab and diagnosis, and I've gone through that a few times, which has been great. And then I pursued more with concussion, a concussion fellowship that I studied, because some of these patients also were a result of a head injury, which made them a lot more sensitive to what's going on. So what was your first question?
Yeah. So no, actually, that answers the question. How you kind of got it. Yeah, absolutely. And I think it's amazing to hear those credentials that you have. And I'd like to ask this question. It might be a simple question for you, but I think for a lot of the audience, what is the difference between a migraine headache and a regular type headache? How would someone know if they have migraines?
It's a great question. The International Classification of Headache Disability 3, the recent one, I don't have it in front of me, but most people have to hit a few criteria. A few of them unilateral. It has to be a unilateral headache.
So one side or the other?
One side or the other, exactly. Another one is that it's worse with movement. It could be nausea, phonophobia, photophobia, sensitivity to light, sound, all kinds of different things. But there's a classification system to it. But most of these people, when they have migraines, they're different than headaches. They have a different origin, in from what we understand now in the theory of migraine treatment and diagnosis. And what we look at with migraines is we look at a 4-stage kind of experience that they go through. The first stage for people with migraines is called the premonitory phase, and they have changes in appetite, mood, sleep, sensitivity to light, all these things that can happen days before they actually have any pain with a migraine, which is pretty interesting. And when they experience these things, they can see changes on functional MRI and PET scans and stuff in the hypothalamus. So we know that there's a really direct brain linkage to that, and you're getting, changes in appetite and mood in these areas that the hypothalamus is important in. And then you have people with auras. That happens next. Not everybody has auras, right? Then the pain stage is actually the third stage.
Oh, wow.
So, yeah. So when you look at the pain stage of migraine, what we look at is you're looking at a hypersensitivity within the Trigeminovascular system. So you and I know what that is, but that's cranial nerve 5, and that's the one that controls your face and head and sensation. People also have sensation in their teeth, and that can be affected with that. Certainly sinuses, all these things. So a lot of people mistake chronic sinus infections for actual sinus infections when they're really migraine affecting the parasympathetic activity of the nerves that are coming out of the middle parts of the brainstem called the pons, and that's where cranial nerve 5 or trigeminal nerve comes from. So to kind of summarize that just a little bit, basically, migraine people have a high sensitivity to anything in their environment, movement, smells, taste, all these different things, where someone with a headache may not have that type of stuff. Right. Someone with a headache may have, tension bilaterally. We get the tension headache, we get the crowns. Occipital neuralgia may stay in the back of the head, those types of things. But there's an extensive classification system that goes into it. But if you look at it, when you see enough of these patients, it's pretty easy to pick out, true migraine versus maybe just someone who's having a headache that maybe seem like a migraine. And then you get other symptoms like vestibular, balance issues, neurological symptoms that can come on.
Wow. Very interesting. And you know what I've found as a society, whether someone is suffering from migraines or maybe it's some other types of ailments or symptoms or illnesses, it seems like we're conditioned as a society to reach for a pill, for a quick fix or a cover up or anything to give us that relief. And I feel like that sometimes leads us down the wrong path, in that we're not really looking for what's causing our migraines or how can we address that and really correct them long term. We're more kind of living for the moment and getting that little bit of a relief. And my question to you is, do you see that as well? And what advice would you give to someone looking, and is there hope that they might be able to someday not have migraines?
Yeah, so there's a lot of research going on, and the more technology we have to research these things, the more we realize what's actually occurring behind it, what's actually causing it. We used to think it was, a purely vascular issue. You get constriction, dilation of blood vessels, and that's what caused the pain. But we know now that's actually just a hypersensitivity within the trigeminal system that's affecting the blood vessels of the dura. And that's why it feels like, pain in the scalp and under, almost like inside the head for some of these people, because the blood vessels of the dura are being affected. So point being, to answer your question, which is a great question, is that there's a lot of research going on so that we can further understand the cause of migraines. Right. And so we can support them with better treatments. Now, the very interesting thing about the work that chiropractors can do and the work that we do in chiropractic neurology is that we actually look at these hypersensitive systems and we look at ways to create healthier neuronal function in those areas. And so the way you create healthier neuronal function or create neuroplasticity in different parts of the brain is by creating the appropriate activation to that region and creating oxygen and glucose, or essentially the proper fuel for delivery. So what chiropractors work on a lot is the autonomic nervous system, right? Right. You and I, parasympathetic, sympathetics, right? Sure. So when we affect the autonomic nervous system, that's actually a major contributing factor to migraines. The autonomic nervous system is a huge impact to it, has a huge impact to it. So what we do as functional neurologists and chiropractors and all these things is we're trying to create a different state of function in the brain. We don't want it to be so excitable, right? And to further confuse anything, here's a diagram that I have up there that you probably can't see, but it's stuff I teach my patients. Essentially, these cells get unhealthy and they become more positively charged, so they become really excitable. So when you create, for instance, a chiropractic adjustment, you can activate these cells and create healthier function in that cell, so you create more protein synthesis, more sodium potassium pumps, more connections to their neural neighbors, right? And so you create more of a negatively resting cell, which makes it less susceptible to activation if the lights go on and they're too bright, to set off a migraine, those such things. So the more we realize that a migraine is a neuronal state of excitability, the more we can treat now the appropriate things.
Right.
You know, and the cool thing about chiropractic is it affects the brain.
Right.
And so we're able to activate the brain in certain ways to help heal it. Now, there are some people with genetic components, and I will say that for some of your migraine patients, thank God for medication, because
Right.
some of these people need a combination, or, you know, a combination of the two. So
Right.
co-treatment can be important for some of these people. That being said, there's a lot of people that were able to get rid of their medications. We're
Yeah.
able to get them off their medications. So, you know, when we look at medications, they can be very helpful for a patient's experience, right?
Hmm.
Yet at the same time, we know they're not treating the cause at this time. We haven't created the medications that will affect the genes on your cells, because what you look at with people with migraines is that one of the things they know genetically, especially with familial, you know, genetic components, is that the calcium channel, voltage gated channels that are in the end of your nerve that basically send a signal to the next nerve through and activate your neurotransmitters. Well, they don't form completely. So they can open, but they don't close very well. So you end up getting this constant signaling of neurotransmitters between parts of your brain that create this excessive firing, especially when it happens in the trigeminal area. You're going to have a lot of pain and hypersensitivity. So those types of people with genetic components, I look at, and we don't know this yet, but I look at them and say, you know, well, medication can be helpful, but also, can I create more, even if there is a genetic, you know, error in some of them, can I create more of the healthier voltage gated channels by creating the appropriate activation and health in that area to strengthen it enough to mitigate, at least partially, or, you know, as much as possible, their migraine experience.
Wow. I find this fascinating, and I think what I hear you saying is there is hope. You know, even if it's
That's right.
even if it's as foundational as genetic material, there's still hope for those people that their lives can be improved, the quality of life can be improved.
That's it. That's right. That's right on. Exactly what I would want you to get from that.
I love that. And our audience listening, for that person who, you know, they've had a past history of migraines or looking for some answers, I think, you know, an obvious next step may be to find a chiropractor, to find even a chiropractic neurologist,
Yep.
but to give them an idea of what treatment might look like. Is there
Yes.
yeah, I'd like to, if you don't mind, dive into that a little
That's, oh yeah, that's a great question. So I can speak to how I treat,
bit.
if you
Sure.
will. And I know how you treat, and you
Sure.
and I treat very similarly in a lot of respects,
Hmm.
which is awesome. But so when I have a patient come in for migraines, what they do is they're here for about an hour and a half to 2 hours for an examination. So they come in, I do a bedside, complete neurological, biochemical, biomechanical
Hmm.
evaluation, chiropractic, and neurological, and we look at their autonomic nervous system tremendously in that first visit too. We do blood pressure seated bilaterally.
Well,
We
yep.
do blood pressure. We have their heart rate. We're checking their heart rate as well. We're evaluating them supine, laying on their back. Then we evaluate them when they stand up. So we can look at, like, we have a screening process that really helps us to look at changes in blood pressure and heart rate that will give us an indication that maybe there's some dysautonomia, or that autonomic problem we're talking about that's not getting enough fuel to the brainstem in the
Yep.
cortex, which would create a hypersensitivity and really just set the stage for a migraine, if you will. That's like the basis. We got to have good blood flow,
Yeah.
because if you have too much sympathetic or stress fight or flight firing, then you're getting vasoconstriction. You're not getting enough blood flow to these areas of the brain, not enough oxygen. Now you're
Wow.
getting enough to survive and not to function well. So we need to stimulate the parasympathetic regions that may be dysfunctional. So we look at that. We do further tilt table testing. We do a testing on a table that tilts up and down, and we look at variations of heart rate variability, or heart rate, blood pressure, all these different pieces, pupillary response, symptoms, nausea, dizziness, changes in anything for them, and we can really actually find quite a bit of information from that.
Mm.
And so I'm using that in conjunction with my bedside testing. And then we're also testing with what we call video nystagmography, which is a really extensive testing of eye movements that relate to brain function. Okay. And we're looking at pupillary response, looking at all these different things too. We're looking at pursuits, following targets, looking at saccades, We're looking at optokinetics. We're looking at gaze stability. We're looking at gaze in the dark, where you can see drifts of the eyes that can show you brainstem imbalances and all these different things. And then we're looking at extensive balance testing on something called a CAPS unit. It's the comprehensive assessment of posturography systems, and that's gold standard for balance and all these different things. So we're tying all these findings together, and essentially what we're looking at is we want to look at their biomechanical function, which is neck, posture, rib function, right? Are they getting enough oxygen in, right? Yeah. What's their jaw function like? What's their alignment? What's their posture? Posture is huge with this stuff, right? You know that. You and I know that. It affects oxygenation and affects the input to the brain. So we want to look at the biomechanical chiropractic side of it very closely. I can't tell you of anybody that I don't treat chiropractically that has a migraine. I may be also treating neurologically and with a lot of other physical therapy, but I'm always treating them chiropractically because that's a big part of a lot of people. Now, some people have an increased neurological part of it, and that is where we do different types of stuff and aspects. And that's where, as a chiropractor, if you're not getting the results you want with your patient, there may be a neurological component that may need to be treated as well to co-treat with you and that patient, like we co-treat with medication and those types of things.
Sure.
So we look at a patient from biomechanical, chiropractic. We look at them neurologically. We look at their oxygenation systems. I do something in my practice called hyperbaric oxygen therapy, which is very helpful for healing the brain and getting oxygen to these starving areas and create the appropriate neuronal function. We look at it from a physical therapy and occupational therapy standpoint, where we look, and I have multiple occupational therapists that work with me that implement a lot of these therapies. We have a PT that we're associated with, all these different pieces that can join chiropractic, neurological function, PT, OT, nutrition can be very helpful for these people, and oxygen. So there's a very, we try to look at every system that can be involved. Yeah. Is how we evaluate, really complete evaluation. And then we do very specific treatments for these individuals to activate the weaker or more affected parts of their brain that are involved with their migraine. Because not everybody, has the same thing, right? Everybody, they can have different parts of their neuraxis, that may be involved. What's interesting though is that in studies they show that in a lot of people the function of the left cortex is more decreased than the right. So there may be a predominance of left-sided hemisphericity issues or decreased function, which would correlate to right lower brainstem, right cerebellum, vestibular, and then all different types of aspects, which has a lot of potential for study and cool things, Yeah. So does that kind of answer it a little bit?
Yeah, no, I love that. It sounds to me like what you do in your office is very comprehensive, but also very customized for each person that comes in.
Yeah, the only protocol approach, if you will, is that we look at every system that could be involved, but everybody has a different treatment.
Right.
Everybody has a very specific treatment, like you said. So I appreciate your understanding of that, clarifying that.
Absolutely, and I appreciate your expertise. It's no doubt, having sat here with you for 15, 20 minutes, that you are a leading expert in the field of migraines. And I think as we close out this interview, it would be great if you would share maybe some contact info, or how would somebody find you if they were in your area, if they wanted to reach out, and maybe they have some questions and would like to reach out to you and ask them.
Yeah, I'm super happy to help with anything. We have patients that come from referrals that come from lots of different chiropractors that we see from all over. We've had people come from Japan, like crazy stuff, but that's, not common. But I work with a ton of chiropractors and helping with their patients and getting them back to function where neurologically they're more stable, and then they can continue with their referring chiropractor, who's their primary physician on it. And they can do it. So the name of my practice is called Portland Chiropractic Neurology, and my email is Dr. MacArthur at Port Chiro. That's DrMacArthur at PortChiro.com. But if you just Google Portland Chiropractic Neurology in Maine, or in Portland, Maine, then you will get our contact information, please give me a shout. I'm super happy to talk with people about this. I'm super happy. I love looking at patients and what people found in helping them with those patients, adding value and adding potential to that patient's treatment. And right now in my career, I do it for free. So that may not always be the case. So you may want to take advantage of that. But I love chiropractic. I love treating patients. You and I know, that we've been together since we started on this journey together and been best of friends ever since. Right. So, but yeah.
Awesome. Well, just a sincere thank you. I can tell that you have a very giving, loving heart, and I appreciate that. And I will make sure that all the information that you just said is on this page so that people can find it. Again, Dr. MacArthur, I could call you Aaron.
Yeah, please do.
I just really appreciate you taking time to do this with us, and I'm sure we'll have you back for many more. So thanks.
Well, it's just nice to talk with you. We haven't talked in a long time. So.
it is nice. Yes, we'll have to talk some more once the record is off here. So
definitely.
Awesome. Well, thank you all so much. And ladies and gentlemen who attended this session, thank you. I will see you guys on the next one.
Thank you, buddy.